Hey everyone, and welcome back to Study Nurse IQ. I'm Jenny, and today we're diving into a critical assessment skill you'll use in every clinical setting, from the ER to a long term care facility: the Mental Status Examination, MSE. The MSE is the gold standard for assessing a patient's cognitive and psychological state. Let's break down the key components and why they are so important for nursing practice. What is a mental status exam? The mental status exam is a structured way of observing and describing a patient's current state of mind. You're probably already doing a mini version of this every time you walk into a patient's room and do a general survey. An in-depth MSE, however, goes beyond a quick glance and provides valuable information for diagnosis and care planning. Key components of the mental status exam. Let's walk through the core components of the MSE, starting with what you see right away: appearance and behavior. Just by looking at your patient, you can learn so much. Is their clothing appropriate for the weather? Is their hygiene and grooming good or poor? Are they cooperative, or do they appear agitated and distressed? Motor activity. Observe how they move. Do they have a tremor? This could be a side effect of a medication like lithium or a sign of a neurological condition like Parkinson's disease. Speech. Listen closely to how they talk. Is their speech slurred, which might indicate substance use? Or are they speaking very rapidly and jumping from topic to topic? This could be a sign of mania. Mood and affect. These are two different but related concepts. A patient's mood is their subjective feeling, what they tell you. Their affect is the objective expression you see, their facial expression and tone of voice. Sometimes these don't align, which can be an important finding. Thought process and content. This is about how the patient thinks. Is their thought process logical and linear? Or do they have disorganized thoughts or delusions? You also need to assess the content of their thoughts. Is the patient expressing suicidal or homicidal ideation? This is a huge safety issue that requires immediate intervention, like placing the patient on one-to-one observation. Perception. Are they experiencing hallucinations? This is a key question to ask directly. Are you hearing voices or seeing things that others cannot? Cognition. Assess their level of consciousness. Are they alert and oriented to person, place, and time? You also need to check their short-term and long-term memory. Insight and judgment. Insight is the patient's awareness of their illness. Do they understand that they have a problem? Judgment is their ability to make rational decisions. Can they make good choices for their own safety and well-being? These observations are critical. For example, if you're discharging a patient home with a new ostomy or a wound vaccine, you must evaluate their judgment and insight. Are they cognitively able to manage their care? If not, you'll need to recommend a skilled nursing facility to ensure their safety and continued healing. NCLEX-style questions. All right, let's test your knowledge with 3 NCLEX-style questions. Question 1. The nurse is conducting a mental status examination on a patient. The patient reports feeling very sad, but their facial expression is flat with little emotion. The nurse should document this finding as a discrepancy between the patient's A. Cognition and insight. B. Thought process and content. Mood and affect. Perception and judgment. Correct answer C. Mood and affect. Rationale. The patient's mood is their reported subjective feeling, very sad, while their affect is the nurse's objective observation of their emotional expression, flat. A discrepancy between the two is an important clinical finding. Question 2. The nurse is performing an admission assessment on a new psychiatric patient. The patient states, "The government has put a tracking device in my head, and they're listening to my thoughts." The nurse recognizes this as a disorder of which component of the mental status exam? Perception. B. Thought content. Insight. Judgment. Correct answer B. Thought content. Rationale. A delusion, such as believing one is being tracked, is an example of a disturbance in thought content. While it also affects the patient's insight and judgment, the primary finding is the content of the patient's thoughts. A disorder of perception would involve hallucinations, e.g., hearing or seeing things that aren't there. Question 3. During an interview, a patient's speech is extremely rapid, and they jump from one unrelated topic to another without pausing. The nurse recognizes this speech pattern as a possible sign of substance abuse. B. Mania. Dementia. Correct answer C. Mania. Rationale. Rapid, pressured speech and a flight of ideas, jumping between unrelated topics, are classic symptoms of mania. Slurred speech would be more indicative of substance abuse. Depression and dementia typically involve slowed speech and a limited thought process. I hope this video helped you feel more confident about performing a mental status exam. It's an essential skill for all nurses. If you found it helpful, please give it a thumbs up and subscribe to our channel. Thanks for watching.